Real statement. Secretary of State for Health and Social Care on Covid-19 update. Secretary of State for Health.
Mr. Speaker, thank you for allowing me to make a statement at this time. Mr. Speaker, the coronavirus pandemic is the most serious public health emergency that our nation has faced for a generation. Our goal is to protect life. Our actions have meant that the spread of the virus has been slowed in the UK, and I want to pay tribute to the officials at Public Health England and the NHS for their exemplary approach to contact tracing and their work so far. However, the disease is now accelerating, and 53 people have sadly now died. Our hearts across this whole House go out to their families. Our policy is to fight this virus with everything we've got. Last week, my right honourable friend, the Chancellor, confirmed a £30 billion package of financial firepower, including a £5 billion contingency fund to ensure that the NHS and social care system have the resources they need. We'll give the NHS whatever it needs, and we will do whatever it takes. We'll get through this by working through our action plan to contain, delay, research and mitigate the virus. And that plan has two overriding aims: to protect the NHS by building it up and flattening the curve, and to protect life by safeguarding those who are most vulnerable. We will do the right thing at the right time, based on the best scientific advice. Earlier, I attended a COBRA meeting chaired by the Prime Minister to decide on the next steps in our plan. I can report to the House that we've agreed a very significant step in the actions that we're taking from within that plan to control the spread of the disease. These actions will change the ordinary lives of everyone in this country. We appreciate that they are very significant, and I understand that people will be concerned. But we have come to the view that they are necessary to save lives and to stop this disease. First, based on the updated scientific advice, we are today advising that if you or anyone in your home has a high temperature or a new and continuous cough, then you should stay at home for 14 days. If at all possible, you should not go out even to buy food and essentials. Instead, you should ask others for assistance with your daily necessities. The exception to this is for exercise. Even then, you should keep at a safe distance from others. If it's not possible to receive deliveries at home, then you should do what you can to limit your social contact when you leave the house to get supplies. Even if you or anyone in your household don't have symptoms, there is more that we have to ask of you. Today, we're advising people against all unnecessary social contact with others and all unnecessary travel. We need people to start working from home if they possibly can. We should steer clear of pubs, clubs, cinemas and restaurants. We should only use the NHS when we really need to. This advice is directed at everyone, but it's especially important for the over 70s, for pregnant women, and for those with some health conditions. It's especially true of London, which the evidence suggests is several weeks ahead of the rest of the country. These measures will be disruptive, but they will save lives. In a few days' time, by this coming weekend, we will need to go even further to ensure that those with the most serious health conditions are largely shielded from social contact for around 12 weeks. We want to ensure that this period of maximum shielding coincides with the peak of maximum transmission. And while the risks of transmission at mass gatherings such as sporting events are relatively low, from tomorrow we will be withdrawing our support for mass gatherings. This will free up critical workers we need to deal with the emergency and ensure a consistent approach to social contact. Second, we're increasing our testing capabilities yet further. The UK has tested more people than almost any other major economy outside of China, South Korea and Italy. We've already increased the number of tests to 5,000 a day, and this is now on its way to 10,000 and then radically further. Third, we are boosting the NHS. Ventilation is mission critical to treating this disease, and we've been buying up ventilation equipment since the start of the crisis. But we need more, and today the Prime Minister hosted a call with the nation's advanced manufacturers, asking them to join a national effort to produce the ventilators we need. We've set up a dedicated team to do this, and we're hugely encouraged by the scale of the response so far. Later today, the NHS itself will set out the very significant steps it is taking to prepare. Fourth, Mr. Speaker, on Thursday we will introduce to the House the Coronavirus Emergency Bill. This bill will give us the powers to keep essential services running at a time when large parts of the workforce may be off sick. Some of these measures will be very significant and a departure from the way that we do things in peacetime. These are strictly temporary and proportionate to the threat we face, and I hope that many will not have to be used at all. They will only be activated on the basis of scientific advice and will only be in place for as long as clinically necessary. Finally, of course, we're ramping up our communications efforts so that people know what steps they need to take to protect themselves, others, and the NHS. Mr. Speaker, tackling coronavirus is a national effort, and everyone has their part to play. The more people follow the public health advice, the less need to bring in draconian actions that I'm keen to avoid. And of course, we mustn't forget the simple things that we can all do. Washing your hands, following the public health advice if you have symptoms, looking out for the most vulnerable in the community. Mr. Speaker, the measures that I've just outlined are unprecedented in peacetime. We will fight this virus with everything we've got. We are in a war against an invisible killer, and we've got to do everything we can to stop it. And I commend this statement to the House.
Jonathan Ashworth.
I'm grateful, Mr. Speaker. And can I thank the Secretary of State for keeping me informed of developments. Our thoughts must be with the loved ones of those who have sadly died from the virus, including the family of the man who died at the Leicester Royal Infirmary in my constituency over the weekend. Can I, Mr. Speaker, pay tribute to all our NHS staff, our social care staff, and indeed all who work in public services. Never have we been more in their debt, and will be in the coming weeks. The public, as indeed all members of this House, want to see the national effort succeed. Every one of our constituents wants to do the right thing for their loved ones, for their neighbours, and for themselves. This virus spreads rapidly. It exploits ambivalence. It demands clarity of purpose, and it demands government effort like we have never seen before in peacetime. With that in mind, can I put a number of questions to the Secretary of State, which I trust he accepts are raised in a constructive spirit? Now, specifically on today's measures, which we endorse. If we are asking people to work from home if they can, what is the advice to those who are not able to work from home because of their occupation? Millions who work in the retail sector, for example. Secondly, today the government will be asking the elderly and those with long-term conditions to shield themselves from the weekend. Could he give us more details of how this would work in practice? Will they be able to exercise, go for a walk, for example? What happens if someone refuses to follow the advice? How will those who need social care support get the care they need? What protections are in place for social care staff embarking upon regular 15-minute visits? How will those with complex needs and disabilities be supported? We know that those with comorbidities and a compromised immune system are also vulnerable. What specific advice is there for those with conditions like diabetes, hypertension, COPD, asthma, cardiovascular issues, conditions which the emerging literature shows are particularly vulnerable at the moment? How will those people get their access to repeat prescriptions, for example? I understand the gravity of the situation. Could the Secretary of State update the House on how far away from the peak he now thinks we are? And while I understand the reasoning for the decisions he has made today, or the government have made, surely there will now come a moment when schools will close. Teachers are already anxious. Parents need to plan. Can he offer parents some advice who will be worried tonight? Throughout this outbreak, we have been at one in agreeing that all decisions must be based on science and evidence. But the Secretary of State, of course, will know and understand that different scientists can reach different conclusions, even when presented with the same data and evidence. So does he agree that all the evidence informing the UK strategy must be transparent, the modelling published, and the evidence base published, so it can be peer-reviewed and stress-tested? This is about maintaining public confidence. Can I just press him on the controversy, if I may put it like that, of recent days with the debate about so-called herd immunity? The Secretary of State said yesterday herd immunity is not the goal. The Chief Scientific Advisor slightly suggested something different on Thursday. If he could clarify the position of the government, but could he also clarify, because this is being repeatedly raised by our constituents, and I hope he appreciates the way in which we're putting these points to him. Many of our constituents are asking us why the UK has hitherto seemed to have taken a different course from other nations. They've suggested that other nations have been deliberately trying to delay, to buy time and prepare for future outbreaks. And in that respect, could he explain why the government has rejected, or if it hasn't rejected, what lessons it has learned from countries such as Singapore, Taiwan, South Korea, who have brought the virus under relative control through containment policies? And what lessons can we learn from Germany and Scandinavia, all of which in recent days, according to the data, are reporting death rates of less than 3 per 1,000 COVID cases, whereas the UK and France, it is much higher? Can I press in on the advice of the World Health Organization? They have been clear. Testing and contact tracing should continue. Many of our constituents are asking us, surely we need community testing to continue, because we need to know the percentage of the population infected at any one time. Otherwise, the percentage of immunity would be unknown. And people who are ill, especially those who work in the NHS, in the care sector, or indeed anyone who is caring for elderly relatives, will surely want to know their COVID-19 status, because it will impact on how they interact with other people in the community. I mean, NHS staff, Mr. Speaker, are being asked to care for COVID-19 patients, not knowing if they themselves are transmitting the virus, or if they get ill, will they now be asked to stay at home for 14 days? Surely if we can test those NHS staff and they get a negative return, we can get them back on the front line sooner. Is the issue around testing around capacity? Because if it is, has the Secretary of State considered demanding that UK-based pharmaceutical companies hand us their labs? Can we use the testing labs in higher education institutions and universities? Can diagnostic kit makers be urged to manufacture more testing kits urgently? And on the issue of a vaccine, which we understand the issues are the timescales involved, but can he confirm that he'll be approving funding for the scale-up of manufacturing of the vaccine candidates that are being developed in the UK? And on antivirals, clinical trials on repurposing drugs are underway across the globe. Can he provide a written statement to the House on what capacity the UK has to assist in this process? Turning quickly to the capacity of the National Health Service. Our NHS and social care staff need support. They need quality PPE equipment, whether in secondary care or primary care. And on the issue of ICU beds, can he tell us how many additional ones have been opened? I think he's hinted that non-emergency elective treatments will now be suspended. Could he confirm that? Members have long asked him about ventilators. Can he just outline the latest numbers and where he thinks we would be by perhaps this time next week? Can he update us on ECMO bed capacity and whether he's increasing the availability of non-invasive ventilation like BiPAP as well? And can I say to him, if we need beds and equipment from the private sector organisations, we should requisition that equipment, not pay for it. Finally, Mr. Speaker, we will cooperate with the government on the proposed emergency legislation, and I'm grateful for the discussions we have had. But the biggest challenge to the public health social distancing measures will not be boredom and fatigue, it will be finances and affordability. The poorest who struggle to pay the rent, those who worry about putting food on their table, those who have no savings to dip into, will be faced with impossible choices between hardship or health. From sick pay and lost earnings protection to universal credit changes to rent and mortgage payment deferrals, we need a package of financial support, and we look forward to working with him on that front. But, Mr. Speaker, these are indeed serious times. Many of our constituents are anxious and want as much certainty as possible. We have put these questions to him because the health and safety of the nation must always come first.
Thank you very much, Mr. Speaker. And can I commend the Shadow Secretary of State for the tone that he has taken throughout this crisis. And he rightly asks questions which I'll seek to address each and every one of them. But just before I do, I'll repeat something that I've said to this House a few times, which is that we welcome the questioning of the approach, because we constantly want to be looking for the very best solution for this nation and the very best way through this that protects life. And so I would rather have, in the tone that he's brought them, the questions from all around this House so that we can try to ensure we're constantly doing the best we possibly can. And that goes for publishing the science and the modelling, which we absolutely will do, because the very best science is done in the open. He asked about the NHS being prepared. And I would say that I'm thankful that we have the NHS all of the time. But in a crisis like this, I'm doubly thankful, because we are reliant on those who work in the NHS, and thanks to the NHS, we are as well prepared as any nation can be, and by some measures, the best prepared for this stage of the spread of a virus. But what matters is giving the NHS all the support that it needs, and especially turning the capacity of the NHS to be able to address with the symptoms and the consequences of this particular virus, which is around ventilation and oxygen supply, as he says. So we are increasing the number of ventilators. We've been buying ventilators for several weeks now, but we also need to manufacture more. And as we've discussed in the House, there is no limit to our appetite to buy ventilators, and there should be no limit to the capacity, to the appetite of industry to make them, because around the world, everybody is trying to increase their ventilator capacity. As he knows, we have ensured that we can use all hospital capabilities in this country, public or private, and bring that to the task. We're expanding the use and the production of PPE and making sure we get PPE to every single different part of the NHS is absolutely vital. We will be cancelling or postponing non-time sensitive elective surgery, and the NHS will make a statement about this later today. We're increasing the ICU bed capacity, but I just want to make sure that the House understands we do not need a generic type of intensive care capacity. Of course we need intensive care capacity, and we need very specific intensive care capacity that can do the ventilation that is needed in many of these cases. Turning to the other questions asked by the Honourable Gentleman, he asked, what if you can't work from home? And the answer is that if you are healthy and if you're not being asked to isolate because a member of your household or you have symptoms of the virus, then of course you should still go to work. It's important that this country keeps moving as much as we possibly can within the limits of the advice that we have given. He asked about shielding and about the elderly. The policy of shielding is specifically about reducing contact for the most vulnerable. And for those who have significant health conditions, the NHS will be in contact with you over the next week, we'll publish a list of those conditions, and if you think you should have been contacted and you haven't, by next week, then get in contact with the NHS. The shielding policy starts later than its general household isolation policy and the general advice to reduce social contact. And the reason it does is because the reduction in contact that we need to see for those who we're shielding is much more significant, and we need to see that last for a significant period of time of around 12 weeks. He asked about those who refuse to follow advice. I don't think many people will refuse to follow advice. Of course, we have powers, and there's powers proposed in the bill should we need to take further action, but I hope and expect that that won't be needed. He also asked about schools. Now, of course, the advice, the scientific advice on schools is not only that closing schools has a significant impact on people's ability to work, especially including in key areas like the health service, but also that if we get it wrong, then children, instead of going to school, might stay with elderly grandparents and therefore increase the risk. But we keep this matter under review, and it's something that we are in constant discussion about. But we haven't changed the advice on schools today. He also asked about other countries. Of course, we're constantly looking to all other countries around the world to see what we can learn about how we can do things better, including South Korea and Singapore that he mentioned. The reason that we're taking these measures at a different time to other European countries is because we are behind them in terms of the progress of the virus, which is a good thing. We're in fact, as the Chief Scientific Advisor has set out, taking these actions earlier in the curve than France and Germany, for instance, did, but behind in time because they are further advanced in the progress of the virus. He asked about testing. This is very important. Of course people want to know their COVID-19 status. We're expanding testing as fast as we possibly can. And the test that the world is looking for is the test that can check whether you have the antibodies because you have had coronavirus. Because then we can find out not just testing of people whilst they have coronavirus, but afterwards if they have had it, and therefore have the antibodies with the immunity that comes from that. That test is not yet in existence, but we are putting enormous amounts of effort into creating it. We also need testing that can be done at the bedside rather than in the lab, and there's a huge amount of work underway to bring that to bear. The same goes for vaccines, of course, and antivirals, which he asked for a written ministerial statement about, which I will, of course, ensure is provided to the House. Finally, he asked about a package of financial support. We put in place a very significant package of financial support at the budget last week, and I had a meeting with the Honourable Gentleman earlier today about what further might be needed.
Peter Bottomley.
I say there are many young people in my constituency, but when I first was chosen, it had the highest proportion of people above retirement age in the country, most of whom are economically active, and those who aren't are often volunteers. I want to pay tribute to those over 70 who are helping people even older than themselves. Yeah. Can I put 3 quick points to the Secretary of State while welcoming all the points he's made so far? And he doesn't need to answer them in detail now. The first is that senior general practitioners are worried that some medicines, controlled drugs which are safe, are being destroyed because the patient for whom they were first ordered may have died. Morphine and the like, the shortage, if that comes, will lead to distress and agony for people unnecessarily. So could the Secretary of State look into that and see whether whatever the requirements are might be lifted during this period? The second is that the advice to reduce social contact may be right and important, but if people are fit and healthy, and if they're running a business, to have their business closed down just because they've hit a certain age doesn't seem necessarily right. And can I add to one of the points made sensibly by the spokesman for the opposition, which is that there's some help for people with mortgages, but many people who will lose their jobs are paying rent. And could you make sure that people are not unnecessarily evicted or threatened during a short-term period of shortage of money?
Thank you very much, Mr. Speaker. The measures on shielding are specifically for those who have significant health conditions and will be contacted by the NHS. They are not for the generality of over 70s who are who are healthy, for whom the guidance is the same as for people of working age, except that we insist that we strongly advise as opposed to advise it. And that is for their own protection, because the over 70s and especially the over 80s are at higher risk, significantly higher risk of mortality, of dying from this virus. The other points he made are welcome. He makes a very important point on rent, and this was part of the discussions that we had earlier today, and I've been talking to the Treasury and the Welfare Secretary about it. Action has already been taken by many banks on mortgages, and the point he made about the availability of drugs is, of course, critical. We have a very, very comprehensive drug supply chain system that we understand well, thanks to the planning that we've done over the last couple of years, and we thus far have not seen shortages outside of those that already pre-existed this virus that we were debating in the autumn, for instance, over HRT, and of course we keep that under constant review.
Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. The Secretary of State will be aware of the concern as to why the UK Government's approach had been such an outlier up till now, including the talk about herd immunity, when it's not clear that actually any immunity from this virus is long-term. The UK is now facing an exponential rise, and I therefore welcome the UK Government decreasing all non-essential contact, as I think it is critical to slow down and limit the spread of this. He talked about, or indeed the briefing from the Prime Minister talked about not providing emergency services to large gatherings, but can he clarify whether the Government are advising against or forbidding mass gatherings? I welcome the talk about increasing testing capability, but the briefing talked about only testing those in hospital and key workers. In Scotland, surveillance testing, which is in practices that monitor disease in the community, is continuing. Will that also be the case here in England? After the confusion over the weekend, and indeed the comments he's just made about healthy people over 70, can he clarify what the advice is for people over 70 who live in their own homes or live in care homes? Exactly. Are they meant to be staying at home, or are they simply meant to be decreasing contact? In particular, is he discussing with social care providers to lengthen the time of each visit so that there is time for the care worker to take precautions? He says the healthy should go to work, but what if they work in a club? What about socially vulnerable, like homeless, or those who have no recourse to public funds, like refugees or asylum seekers? What provisions being put there? We on these benches welcome the measures in the budget, but when will the devolved governments know exactly how much funding they will have to mitigate the economic impact of this in the 3 devolved nations? And finally, what further changes will be carried out in the Houses of Parliament to ensure that core services continue without increasing the risk, particularly to older members of both Houses?
Thank you very much, Mr. Speaker. We do not support mass gatherings. We've made clear that we do not support. We have advised against unnecessary social contact, so it goes without saying that we do not support mass gatherings. She asked about surveillance testing. We have in the UK, across the UK, one of the biggest surveillance operations in the world of coronavirus. Of course, it happens in Scotland, but it happens right across the UK. She asked also about Parliament. And, Mr. Speaker, I understand that you've been having discussions today about how Parliament will operate, but I think that the whole House will be sure in our collective decision that Parliament, although it may have to operate differently, must remain open.
May I join with the Secretary of State and the Shadow Secretary of State in commending all those and paying tribute to all those who work within our National Health Service, upon whom we rely day to day, but rely all the more so under these conditions. Can I say to the Secretary of State, if I may press him on 2 points that have been raised by others, but the World Health Organization advice was very clear: test, test, test. At an earlier stage, the UK changed its testing requirements, and those who have symptoms and self-isolate are no longer tested. If the full information is to be available, surely the testing has to be very significantly increased. Who exactly is going to be tested? And one of the difficulties, I think, has been the information, the way the information has been presented. And so that we see, just to pick up the point that the spokesman from the SNP made about the over 70s, but it was echoed elsewhere. The headlines are that over 70s, even now, that over 70s are going to have to stay at home for 12 weeks. Can the Secretary of State be absolutely precise as to what the advice is for over 70s and those with other conditions and what those conditions are? And then finally, this question of 7 days or 14 days self-isolation. My understanding was that if you had symptoms, you should and were on your own, you should self-isolate for 7 days. But if you were in a family, the whole family should self-isolate for 14 days. Perhaps he could confirm.
Thank you very much, Mr. Speaker. My right honourable friend is precisely correct on that and the third of those questions. The difference between the advice for 7 days and 14 is precisely as follows: that if you have symptoms yourself, if you live on your own, then you should self-isolate for 7 days. But if you live in a household with others, then the whole household now needs to stay at home for 14 days. The reason for this is that if you live in a household with somebody who has coronavirus, it is highly likely that you will catch it. And therefore, it's important to protect from the onward transmission that everybody stays at home. That's the reason for the distinction between the 7 days and the 14 days, and I hope that's clear. 7 days for individuals, 14 for households. On the point about the World Health Organization saying that we should test, I wholeheartely agree. And we have continued the increase in testing in this country throughout this outbreak. The point that was made last week is that as the increase in number of cases continues, so our increase in testing capability must increase faster, and therefore at this stage we have to make sure that the use of the tests we have are prioritised, and as we expand testing capability, so we will expand out the number of people who can get hold of those tests. I understand the frustrations. Of those who want a test, but I'm sure that the whole House will agree that we've got to make sure that we use those tests on the people who need them most, and that means saving lives in hospitals. On the point about the over 70s, again, to reiterate the answer I gave just a moment ago, the advice to everybody is to avoid unnecessary social contact. For the over 70s, for their own protection, that is strongly advised. And the shielding, which is essentially reducing as low as possible all contact, is for those who have underlying health conditions and will be contacted by the NHS. The precise details of all of these will be published on the gov.uk website so that everybody can see not only the answers to the question which I'm giving, but can see the precise wording of what we expect everybody to do, as I've set out in the statement.
Miliband.
Thank you, Mr. Speaker. Can I say to the Secretary of State that this House has always come together at times of national crisis as one, and this is the spirit across the House today. In that spirit, can I ask him to match the unprecedented public health measures he has announced today with unprecedented economic measures to support all of the businesses, large and small, their workers, the self-employed, who will be affected by the measures announced today. And we've seen across the world, for example, in Denmark, workers' wages being guaranteed by a combination of government and employers. And it is no fault of the Chancellor of the Exchequer that his budget was last Wednesday and is now out of date. But can I use the Secretary of State to urge him to come back to the House with economic measures that match the gravity of the moment?
I absolutely understand the point that the Right Honourable Member is making, and he's right to make it. Of course, these are matters for the Chancellor of the Exchequer rather than me. There was a G7 call today, which the Prime Minister participated in which economic considerations like this were considered. But the final thing I'd say is, Mr. Speaker, every single one of us in this House will have businesses in our constituencies that are already facing the brunt of this virus. And we saw from the collapse of Flybe right at the start, what feels like weeks ago now, the very significant economic consequences, and we have our eyes wide open to those.
Thank you, Mr. Speaker. Can I warmly welcome the measures announced today? People have debated when these were going to be introduced, but the government has today shown it has the courage to introduce very tough measures which will have profound economic consequences, and that will reassure many people up and down the country. In the constructive spirit of the Shadow Health Secretary, I just want to ask a couple of things about the measures that were introduced. Firstly, he is advising people not to go to clubs, cinemas and restaurants. Will he also advise clubs, cinemas and restaurants to close their doors so there is absolute clarity that people should not at this moment be engaging in these activities? Secondly, if someone in a household is symptomatic, he is advising the whole household to self-isolate for 14 days. I understand the logic behind that, which was very clearly explained, but the World Health Organization advice is to test and isolate every single suspected case of the virus. So could he just explain why there is that divergence? And thirdly, just to follow up the question asked by my right honourable friend, the Prime Minister, former Prime Minister, is the advice to healthy over 70s who do not have an existing long-term condition that they should be part of the new shielding policy that is happening at the weekend, or is that shielding policy just for over 70s with an existing health condition?
Mr. Speaker, on that last point, no, the shielding policy is only for those with existing health conditions, and those who we're going to ask to participate in shielding from next week will receive a contact from the NHS and will publish the list of conditions that we consider necessary for shielding. On the point he makes about testing and isolating, I strongly agree with the World Health Organization about the need for testing. And I spoke at the weekend to Dr. Tedros, the head of the World Health Organization, and we strongly agree on the need for testing. The question is, how fast can you ramp up testing capability when the tests that we need, which are the blood tests to know who has had coronavirus, and the bedside test or the home test, so that these tests can be expanded rapidly across the whole country. The first of those is yet to be invented, although we hope that it is fairly soon. The second of those has just been invented in the last few days, and we're in intense negotiations about rolling those out very rapidly here.
Thank you, Mr. Speaker. Today I bring a message from my colleagues who are working so hard on the NHS front line. They say that they don't have the protective equipment that they need, nor do they have the capacity to manage the spread of infection in their own departments. There is clear concern from hospital staff and the wider public alike about the transparency of the plan to tackle the virus. Does the Secretary of State agree with me that our incredible staff must immediately have the protective equipment they need to be safe, that they should be tested if they show symptoms of virus infection, as currently not all of them are being told that they can, and that more information must be transparent so that medical teams across the country can prepare their departments for the very worst? Thank you.
The whole of our action plan is based on the science and on as much transparency as possible, and we have exhibited unprecedented transparency in this crisis so far, and I pledge again to full transparency, publishing, for instance, the modelling that underpins the scientific advice, and also publishing the action plan 2 weeks ago, that at the time felt like we were looking at some things that were quite out of the ordinary, and I don't think anybody then anticipated that we would be having to to bring them in the way we have, and many countries around the world have now brought in. So I pledge once again to that transparency. She's completely right about PPE, and we need to expand the amount of PPE. We are, again, buying that, like ventilators, as fast as we possibly can, and part of our call for this national effort to manufacture also includes for PPE. And I just want to finish my answer to the Honourable Lady, Mr. Speaker, by saying something about those who work in the NHS. Because the NHS is going to face an extraordinary time, and many people are going to do extraordinary things, but it is going to be very, very difficult. And I pay tribute in advance to the service that every single person who works in the NHS is going to give. She says staff testing from a sedentary position. She's right to remind me of that part of the question. Of course, we want as much staff testing as soon as possible. We're using the testing capacity that we have to save lives, and saving lives includes saving lives of the medics.
Steve Bryan.
Mr. Speaker, in the last 24 hours or so, I've spoken to a great number of the head teachers in my constituency. I think it's fair summary to say that there is support for the decision to keep schools open, and I agree with them. However, there is great concern that no matter what we might want to do, an increasing number of teaching staff who are becoming unwell themselves and therefore not able to be in school might end up forcing the issue and leave heads in an impossible position. So if we're to avoid that, can I ask the Secretary of State, and I feel slightly guilty asking this because he is the Health Secretary, but this is the statement that we have today, what is the government view on relaxing the student-staff ratio, on getting Ofsted off schools' backs now, please? And if we were to move to a skeleton service in schools to allow key workers to keep working, how are we to define key workers given that we are in the middle of a national crisis?
Yes, we're looking at all of those points. The proposals to relax student-staff ratios is in the bill, and we'll be publishing the content of the bill tomorrow and the bill itself on Thursday. The point that he makes about key workers is incredibly important, and I'm working hard with my right honourable friend, the Education Secretary, to address exactly the sorts of concerns that he raises, because, of course, schools play an incredibly important part, not just in educating our children, but in allowing so many people to go to work, but we've got to make sure that they're safe as well. One of the blessings of this virus, Mr. Speaker, is that it spares children in almost entirely, and that means that it is safe for children to go to school.
Ms. Kendall.
Could the Health Secretary give some reassurance to the public about his plans for social care, which many vulnerable elderly and disabled people rely on? In particular, what plans he has to ensure that the care workforce can effectively continue. We've got over 120,000 vacancies already in this area, and half of all home care workers are on 0 hours contracts. Yeah. Is he confident that the care workforce can do what elderly and disabled people and the NHS need?
It's obviously an incredibly important area. There was a call with local authority leaders and my right honourable friend, the Community Secretary, and the Care Minister earlier today. It's an area of enormous amounts of work, and we will do everything we can to support social care.
Dr. Luke Evans.
Thanks, Mr. Speaker. And can I congratulate both the Secretary of State and indeed the Secretary of State, Shadow Secretary of State, of their tone in this debate. One of the questions that I'd like to ask is particularly around most people will inevitably get infected. Most people will recover. Could he tell us when those people can recover and return to work and what the impact will be on that?
Yes, most people tend to recover within the 7-day period from getting first symptoms. Most people, not all, and many become very ill. But for most people, this is a mild to moderate illness. And once they've recovered, the vast majority of the evidence is that the illness does not come back for some time. But of course, all of this evidence is kept constantly under review.
Neera Wilson.
Thank you, Mr. Speaker. Would the Secretary of State clarify some details in reference to the answer he just gave to the Honourable Member for Tooting on testing of our frontline healthcare workers, And indeed, just as importantly, our frontline social care workers. Our services are stretched to the max already. We cannot afford to have those who do not need to self-isolate, self-isolating once, potentially multiple times, if they do not know whether they have had the virus.
Entirely understand this point, and I want to get testing to everybody who needs it as soon as I possibly can.
Red Clark.
Thank you very much, Mr. Speaker. I join with the Secretary of State and his shadow in extending sympathies to those that have died of the virus and our admiration to those members of the NHS and others who are coping with it. Can I press him a little on the testing? Because it's very important that if you're relying on scientific evidence, then we should be transparent about this. So will he say when he's going to publish the scientific evidence that he mentioned in his statement? And secondly, there has been a change in policy on testing. It has been the case until the end of last week that people could be tested through drive-in or home visits. That no longer is the case. Is this because there is not the quantity of vaccines available? If so, will that be restored when that is available? And when does he expect that to be?
On the testing point, it's precisely because at the start, when there were very small numbers of cases, we had enough tests to test everybody who had suspected symptoms. As the number of cases has risen exponentially and our increase in the number of tests has proceeded, we need to make sure that the tests that we have available are there for saving lives. But we hope that with the introduction of a home test or a testing equipment that can be done at the bedside, which we've discussed before in these exchanges, that we can radically increase the number of tests and get ahead of the epidemiological curve as soon as possible. We're in live negotiations about bringing that in.
Can I just say to members, we'll run this for around 1 hour, so if we can speed up on questions and answers. It might be helpful if we try and help each other and not to hold each other up now. John Cryer.
Thank you, Mr. Speaker. Many of us have thousands of constituents who are either on zero-hours contracts or are self-employed. Now, I've raised this question before, but unless the government can offer those people some sort of minimum income guarantee, they will very quickly be in the area of repossession and homelessness.
Yes, of course I understand that, and it's part of the discussions I've been having with the Welfare Secretary and the Chancellor of the Exchequer.
Dean Russell.
Thank you, Mr. Speaker, and thank you to my right honourable friend and everyone in the House, really, for such a calm response today. I have two brief questions. One is one which has been raised several times. It may sound flippant, but it is an important one, around pets. People are asking about, can they walk their pets when they're self-isolated? The reason why I ask the question is because if you are self-isolating, are you due to be housebound fully, or can you go in a park and walk your pets in that instance? The second question is... very briefly. I'll be very quick. In Watford, we've got a great volunteer network popping up, and I'm sure that's happening across the country, across all parties. What I wanted to ask was, will there be guidance for volunteers in terms to make sure they're not spreading by doing the right thing?
The answer to the second question is yes. And the answer to the first question is people should go outside. Yes, walk your pets. But if you're in household isolation, do go outside, but try to avoid other people. It's very important that we look out for each other as communities and people do get exercise that they need.
Ian Murray.
Thank you very much, Mr. Speaker. I appreciate this isn't within the remit of the Secretary of State, but he's announced that the government will advise people not to go to pubs, clubs, restaurants, etc. But unless the government mandatory closes them down, they can't claim on their business insurance. So will the Secretary of State please have a diktat from the government that actually formally closes these businesses down?
Well, we've set out the advice today, and I'll look at the point that he raises.
John Redwood, Sir John Redwood.
Will the Secretary of State make sure that in the legal powers and guidance, all our councillors who are over 70 can participate fully in council and committee meetings from their home using technology?
Well, indeed, and technology has a huge role to play in helping people through this.
Vic Cooper.
Mr Speaker, everybody wants us all to be able to pull together and support the same strategy, and the Health Secretary will be aware of the real unease that there's been, that there are differences between the UK's approach and other international approaches. So can he now reassure us that the government's objective is the same as the WHO objective, who have said today that we should be testing everyone who has symptoms, not just waiting for a future test that might work in different circumstances, but that is the objective, to test everyone that has symptoms now? And can he tell us what his target is for how many new tests a day he wants to be able to do, and by when? Because I've been contacted by GPs self-isolating because they cannot get tests.
Mr. Speaker, the answer is yes. We want, of course, all of the tests that we need.
Testing once again. Does the test give evidence of no infection, to the point that the Honourable Lady was making about frontline health workers? And is the Secretary of State saying today that there is an immunity that does build up? Has that been medically confirmed if you've had it once?
Secretary of State.
On the latter point, the Chief Medical Officer has set out today that the immunity is built up by having had this virus, and they constantly keep that evidence under review, but it does appear to be built up. On the testing point, just as with the Right Honourable Lady opposite, of course we want tests to be available for everyone. Our goal is to beat this virus. We want to make sure that all of our medical frontline staff can have the testing, that everybody in the community can have those tests. Where there are only a limited number of tests available, we have to use them to save life, and I am working as fast as I possibly can to increase the number.
Thank you, Mr. Speaker. The Secretary of State said this was a national effort, and he's right, but it's more than that. This is a global crisis that has seen different approaches in different countries. Does the Secretary of State not accept that we need stronger, coordinated global leadership, both on the health front and the economic front, to get the best possible response to this global crisis?
I half agree with him, Mr. Speaker, and the reason is that I think that international coordination is important, and I've been participating in regular G7 calls, as has the Prime Minister and the Chancellor of the Exchequer. But we are on different countries are also on different places on the curve. So, for instance, we have introduced measures like these earlier on the curve than similar countries like France and Germany.
Bradley.
Thank you very much, Mr. Speaker. Can I repeat the point that was made by the honourable gentleman from Edinburgh about pubs and restaurants? I've been contacted by a number from the Moorlands today, particularly concerned in the run-up to Mother's Day, which would normally be one of the busiest days of the year. Can the government give firm advice now as to the fact whether they should close or not, so that they can claim on insurance if they're able to?
Well, we're advising against all unnecessary social contract. I appreciate that this has consequences, and I regret having to take these measures. I really do. But we are having to fight this virus.
Ben Bradshaw.
When exactly did the government start buying extra ventilators? How many more have they managed to get, and how many more do they need?
We started weeks ago. I can get back to him with the exact date of the first time I authorised the purchase of more ventilators, but it was very shortly after it became clear that ventilators are the thing that is needed to support people who have coronavirus. On the second question of how many more do we need, we will buy however many will be produced.
David Mundell.
Thank you, Mr. Speaker. I was very pleased this morning to hear Nicola Sturgeon say that she supported the UK government's approach. But of course, the devolved health service, the police, the education service are different. There will inevitably be different operational decisions made in Scotland. How can that be respected at the same time as ensuring that we have a common message across the United Kingdom?
Well, my right honourable friend is right about the advantages of a common message across the United Kingdom, and we've worked very hard to try to achieve that. I personally visited the 3 devolved nations on Friday to meet my counterparts to try to ensure that we have as coordinated a message as possible. But of course there are differences in the delivery of our local NHS.
Sir Geoffrey Dodds.
Speaker, the Secretary of State made reference to the special measures announced by the Chancellor last week, and yet the Northern Ireland Executive have yet to have a clear indication as to what the consequentials are for our funding in Northern Ireland. This inhibits our ability to respond to this crisis and to provide leadership and direction to people in Northern Ireland on the schemes that we can implement.
My Treasury colleague tells me that undoubtedly the devolved nations will very, very rapidly get the information that they need. After all, this is a UK-wide effort.
Sir Bernard Gentleman.
Thank you, Mr. Speaker. Will my right honourable friend join with me in thanking the thousands of local community groups who are already mobilising in order to deal with what may be a very serious situation in their communities, looking after vulnerable people and even nursing the sick? And will he, with his right honourable friend, the Prime Minister and others, make sure that we mobilise these people and empower them to take decisions without having to wait for instructions?
Yes, I think this is incredibly important. I mean, our communities have got a huge role to play. This is truly a national effort. And I want to empower people on the ground in communities and within the NHS to do the right thing by what's in front of them. We'll support wherever possible, but people shouldn't wait for the instruction. They should get on with it.
And Mike Moran.
Thank you, Mr. Speaker. The WHO has advised test, test, test. The Secretary of State has said there's a limited capacity of testing kits. Can he tell us when the testing kits are going to be made available, what time frame, and how many does he think we're going to need?
As many as possible, as soon as possible.
Nicky Aitken.
May I thank my right honourable friend on the sterling job that he, his ministerial team, his officials and everybody on the front line of this crisis is taking. Does he share my concern of reports I've had in my constituency over the last few days of local pharmacies hiking up prices of products like sanitizer and masks, when we should all really be working together and, rather than profiteering, acting responsibly?
Well, I think everybody has a responsibility. Citizens have a responsibility to follow the public health advice, and all of us have a responsibility, for instance, to make sure that we buy only that which we need. And of course, businesses have a responsibility to look after the communities they serve.
Very much, Mr. Speaker. Can the Secretary of State confirm that it is now the government's wish, subject to capacity being available, to test all those with symptoms who are at home? And if so, as the capacity ramps up, how does he intend to prioritise tests of people living at home, potentially with the disease?
Yes, the Right Honourable Gentleman asked the question very precisely and correctly. The answer is yes, it is our intention, and that Public Health England will advise on the order of priority for the use of these tests.
Damien Collins.
People want accurate information during this crisis. Is the government considering creating an offence for the malicious spreading of disinformation about the coronavirus with the intent of harming the public health, and to require social media platforms to act against known sources of that disinformation should they occur?
Well, what I would say to the Honourable Gentleman, who I know is an expert in this area, is that so far the social media companies have acted with great responsibility in this area and responded to all of the asks that we've had of them.
Chris Stevens.
Speaker, the government is trying to regulate behaviour, so to avoid some of the scenes we've seen at the weekend, would you encourage supermarkets to allow the elderly to have 1 hour a day for only them to shop to get their essentials?
I've seen this call, and I've seen how the Australians have done it, and I've discussed it with the Environment Secretary today.
David Green.
Thank you, Mr. Speaker. Can I ask my right honourable friend about specific, very vulnerable groups? A mother in my constituency is keeping her 4 children off school because her husband is a diabetic and she doesn't want to put him at unnecessary risk. Is she doing the right thing? And more generally, what should pregnant teachers be doing? Should they be going to work now, or is that too risky?
I think in both cases, these cases are covered by the formal public health advice that will be published on the gov.uk website. And for all the very specific questions like this, which of course our constituents will have, I would refer them to that advice to make sure that we get the answers completely accurate.
Rachel Reeves.
Thank you very much, Mr. Speaker. We're now quite rightly asking people, including the self-employed, to self-isolate for 7 or 14 days if they show symptoms of coronavirus. The self-employed do not qualify for statutory sick pay. There is no one else to pay them. So will the government revisit statutory sick pay for the self-employed, paying statutory sick pay at a rate which enables them to put food on the table and pay the bills? Because unless we do, we're asking people to make impossible decisions.
This is it's an issue I discussed with the honourable gentleman on the front bench. A delivery of support to make sure that nobody is penalised for doing the right thing is incredibly important. But as she says, there is no employer for those who are self-employed, so it has to be delivered through the benefit system.
Notes.
With flight restrictions across the world, many of us have constituents who are stuck abroad. Can my right honourable friend provide reassurance that there is consular assistance available and that he is working closely with the FCO so stranded constituents in countries which have imposed flight bans can get home?
Yes, that's an incredibly important point that I discuss regularly with with the Foreign Secretary.
Vicky Foxcroft.
Mr. Speaker, food banks will be under unprecedented pressure in this period. What measures will be put in place in order to provide volunteers with protective equipment? And will he consider requiring supermarkets to put aside stocks and provide donations to food banks in this crisis?
Well, as we expand the amount of protective equipment, I think that we should look to and work with food banks who have an incredibly important role to play, and I would certainly urge supermarkets to do what she asks.
John Barron.
In welcoming this package of measures, I very much encourage my right honourable friend to encourage businesses to be as flexible as possible so that employees can work from home, to step up testing for emergency and public sector workers. But can I also ask him to particularly focus on the elderly and the vulnerable who are living alone? Because there is a risk in this sort of scenario that they become inadvertently ignored by the system. What more can the government do to reach out to these people, whether it's by looking at the voting register or whatever, to ensure that they're being catered for, because they are particularly vulnerable if they're living alone?
He makes an incredibly important point. One of the reasons that we have held off from taking measures like this for as long as we have is because these measures have quite significant downsides, many of which have been discussed in this chamber today. So, of course, I urge the people to follow the advice that my honourable friend gave, and for communities to come together as much as possible to help each other through.
Thank you, Mr. Speaker. Secretary of State, we need a plan for scaling back schools. The teachers are saying to me that they're part of a mass collection of people every day, and they're concerned about being infected, but they're also concerned about relatives that may have secondary illnesses. They're also concerned about colleagues who are pregnant. Schools are losing pupils and they're losing staff, and they will close of their own volition unless we have a plan to scale them back and provide essential childcare for those workers that still need to work and the children that will still need to go to school.
I understand why some parents are concerned, but I would also say that because the evidence is that children are not badly affected by this virus, it is important to take that into account. And also the point that he makes about people who need to go to work not being able to because of childcare responsibilities are very serious in terms of the impact that it could have, and so very important to take into account.
Sharp.
The last 2 hours, the Prime Minister said that school closures will be kept, quote, under review, end quote. In the event of a school needing to close, can I ask the Secretary of State, who takes the final decision? Is it the government? Is it a local education authority? Or is it the head teacher?
It is the head teacher, and we have there are discussions with the Regional Schools Commissioner in England in these cases, and it's something that we are looking to address in the bill.
Paula Barker.
Thank you, Mr Speaker. I'd like to join with honourable members in this House in placing on record my condolences to the families of those who have lost loved ones, and also pay tribute to the workers in the NHS working around the clock, and also those workers in social care. After a decade of austerity, our NHS and public health were already at breaking point, even before the current coronavirus hit our communities. And public sector workers have borne the brunt of austerity over those last 10 years.
Yes, you're right.
The very workers who are expected to continue to provide services to the most vulnerable people in our society. Mr Speaker, today I've been contacted by Paul, a critical care nurse in my constituency, who has to self-isolate after developing a cough. He's been told he will not be tested. His skills, along with those of his colleagues, are vital to care for patients. And frontline staff need to be...
We're going to have to stop the questioning because I've got to get everybody in. Just a minute.
Hey, Mr Speaker, when will local government be provided with the additional ring-fence funding for public health? And also, when will public health be provided with their allocations for the new financial year?
Mr Speaker, I've addressed the question on testing repeatedly. I'm delighted that we go into this with a record number of people in our NHS, and I pay tribute to each and every one of them.
Bob Shealy.
Speaker, Covid-19 will may put particular pressure on the dozen or so unavoidably small hospitals that serve isolated and island communities. We have one respiratory consultant on the island and we are very dependent. I know that he is very busy. Will he assure me that isolated communities will not be forgotten about when it comes to mutual aid, clear advice and the supply of medicine and equipment?
Absolutely, and I discussed it with officials today.
Afzal Khan.
Thank you, Speaker. Last week, I asked the Secretary of State why public health advice about Covid-19 had not been translated into any language other than English. Coronavirus has been present in the UK for over a month, and it has been 5 days since I raised this issue with the government, and yet there are still no translations available on the NHS England website. Can the Secretary of State provide an update on when exactly these will be made available? And will you clarify which languages the Department of Health are currently working on?
Yes, we're going to do this as soon as possible, but the honourable member will also, I'm sure, understand that we have just published new guidance that we've been working on, and this is a very rapidly evolving situation, so we will translate it as soon as we possibly can.
Thank you, Mr Speaker. Can I endorse a point from the honourable member for Glasgow South West about having an hour in a supermarket, which I believe Iceland is already doing, where older people can purchase food before it is stockpiled, etc. But can it also include mothers of very small children? Because I'm afraid I've heard today of some scarcity in baby products, which is, of course, a great concern for us all.
Yes, I think this is a very good suggestion. It's one for the Environment Secretary and the supermarkets, of course, but it's an example of people pulling together to help the most vulnerable.
Yes, Philippa.
Mr Speaker, in answer to the question asked by the member for Leeds West, the Secretary of State stated that benefits couldn't be paid, that people had to take it through the benefit system, unlike maternity allowance, just as an example. And just to speak for a moment about the benefit system, my own brother, who is a universal credit claimant and an agency worker, has likely lost his job because he had to self-isolate for a period and it won't be kept open for him. He now, in the lag of universal credit, won't get anything until early May. Yep. The Secretary of State needs to tell us now when he will come before us with a package of financial benefits for business and people, because it is getting too late.
Well, we changed the law on Friday to take into account the need to make sure payments are made from day one in some of the benefits, but it is absolutely the case. It is absolutely the case that statutory sick pay is paid by employers. So for the self-employed, there is no employer, and we cannot put in place, in the time that is necessary, a whole new system. We need to make sure that people use the benefits system that exists.
Jacob Young.
Thank you, Mr Speaker.
Will the Government consider giving the much-needed funds to support businesses directly to regional mayors and combined authorities so that businesses in Redcar and elsewhere that are affected by the coronavirus can have the help they need without delay?
I'm discussing with the Chancellor of the Exchequer a further package of support because it is absolutely clear that the measures that we are having to take will have a very significant impact on business.
Streeting.
Thank you, Mr. Speaker. Professor Costello of UCL says the virus is particularly contagious at the early stages before symptoms present. Given the prevalence of this virus in London in particular, is the current government's strategy based too heavily on responding to observable symptoms, and isn't there a case now for going further, faster, particularly in London?
Mr. Speaker, the point behind household isolation is precisely to address the concerns that he's raised, and also, by reducing all unnecessary social contact, we will help to reduce the sorts of transmissions that he talks about.
Thank you, Mr. Speaker. Will the Secretary of State explain how he and his team have been working to learn from the experience of other countries that are ahead of us in the curve so that we can see the things that they've done well and the things they haven't done so well?
Yes, we're constantly looking at what's happening around the world and what people are doing and the research in order to try to make sure we calibrate the very best possible response.
Mr. Speaker, many of my constituents live in severely overcrowded accommodation or in single hostel rooms. There is a looming public health crisis in the short term and a looming long-term mental health crisis because of the conditions they'll have to self-isolate in. What advice and what is the Secretary of State going to do about those people?
Yes, of course, we're incredibly concerned about this, and this is reflected in the guidance that we've specifically put out, and is one of the many reasons why we encourage people to get outside, even if they're in household isolation, so long as they don't come into contact with others. Because, of course, I understand the consequences of the advice that we've given for people for her constituents.
Hammond. Thank you, Mr. Speaker. Many of those who the Secretary of State will want to shield at the weekend and are self-isolating are in receipt of at-home social care. Can he be clear about the guidance he's going to give about whether they should still be continuing to be visited, or what else he would do to put in place to protect those individuals?
Yes, of course. The further advice will go out for social care. We put updated advice out at the end of last week in knowing that this was a likely step. And there'll be further advice precisely to help people to address exactly that question.
Judith Cummins.
Given the anxiety from schools, colleges and universities around exams, would the Minister reassure students and staff alike that there's provision in place for exams to take place within the cycle of this academic year? And would he also reassure the House that in the event of school closures, there's provision in place to feed those children who are currently in receipt of free school meals?
Both very important points. Children who receive free school meals often receive their best, or in some cases their only meal, at lunchtime at school. And it's an issue I discussed with the Education Secretary over the weekend.
Damien Hines.
Mr. Speaker, my honourable friend from Folkestone talked about the importance of information consistency. But some constituents are seeing competing messages which look like they come from credible sources and then are passed on in good faith. In the worst cases, not only do they mislead, they can even be dangerous. So can I encourage my right honourable friend to continue his work with the platforms, not only to ensure the primacy of the official information, but to actively work against that which disinforms?
Yes, he's absolutely right.
Claudia Webb.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. The Spanish government recently announced sweeping measures to take over private healthcare and requisite services like ventilators, testers and indeed face masks. We heard in the UK that the Prime Minister was indeed actually ordering the NHS to acquire resources from the private healthcare at a tune of something like 2.4 million today. Mr. Speaker, will the Secretary of State outline measures that the government will take to ensure that we put private health, that we put public health, public safety before private profit?
I'm absolutely delighted at the response of the private hospitals who are rising to this challenge and we're working very closely with.
Roberts.
Could my right honourable friend outline what discussions he's had with the First Minister of Wales to ensure that the plan is consistent and that constituents don't get mixed messages? And along those lines, would he appeal to certain sections of the media to realise the power of their platform and encourage them not to undermine the official advice?
Yes, it's very important. I was in Cardiff on Friday to discuss this with my opposite number who attended the Cobra today, and we're working very closely with the Welsh authorities who, of course, run the NHS in Wales.
Ben Lake.
What consideration has the government made of the possibility that some people, especially those living in London, may, in light of today's announcement, decide to move from more urban areas to rural areas? And will the Secretary of State reassure us that additional resources will be made available to local health authorities should there prove to be a significant shift in population?
Yes, of course, I'll keep both of those under review.
Graham.
Mr. Speaker, last Friday, the heads of all the NHS services in Gloucestershire held a conference call with the 6 MPs of the county, and very helpful it was, indeed, in answering all our questions and giving us information to share with constituents. Does my right honourable friend think this is something that could be done in every cluster of NHS around the country?
Yes, and I have asked Simon Stevens, the head of the NHS, to ensure that local trusts and CCGs keep their local MPs informed of what's happening locally, what's having to happen, and how they're responding. Now, of course, the NHS is incredibly busy at this time preparing, but I think that would be a good idea.
Alison McGovern.
Thank you, Mr. Speaker. What extra support will be available for pharmacists, and when will local authorities know what their public health funding allocation will be?
Well, the public health budget is going up, and as far as the pharmacists are concerned, they're an incredibly important part of the NHS family.
Bob Blackman.
Thank you, Mr. Speaker. The most serious people at risk are those with underlying conditions. Will the public health agenda being published promote how people can minimise those conditions, for example, giving up smoking and leading a healthier life, so that we can actually minimise the number of serious cases that are seen by the NHS?
Absolutely right. It is abundantly clear from all of the research into previous coronaviruses that smoking makes the impact of a coronavirus worse.
Cabley.
Thank you, Mr. Speaker. Every time the Prime Minister makes a statement on coronavirus and the advice changes, the 111 hotlines go mad. 111 call handlers are asking that the script changes in real time because without it they're required to keep to the script, and on Thursday there was a 3-hour delay before the scripts were updated. Please could the Secretary of State please look into this and change it for next time?
Yes. Firstly, I want to pay tribute to the 111 call handlers and the clinicians who have just done an amazing job over these last few weeks. I don't know what we would have done without them. The second thing is that the 3-hour turnaround of the script changes was an unbelievable task for those who implemented it. They did a magnificent job to turn it around so quickly, and I, of course, applaud them for doing so and would wish them to be able to turn it around even quicker, but they did an amazing job doing it that fast.
Jim Brown.
The Secretary of State's announcement today will mean that large numbers of elderly and vulnerable people will be required to self-isolate. Will the government therefore coordinate all the volunteering organisations, because large numbers of people will be required to deliver necessities to those vulnerable groups?
Just like we've introduced a national effort for ventilators, so we are introducing a national effort for volunteers. And my right honourable friend, the Culture Secretary, is leading that drive.
Kevin Brennan.
Thank you, Mr. Speaker. In answering my right honourable friend from Leeds Central earlier, the Secretary of State made it clear he wanted everybody to be tested at home if they had the symptoms. What's the difference between the number of new cases currently and the number of tests that are currently available per day?
Well, our estimate of the total number of new cases is significantly higher than the available tests right now, and that's why we need to increase testing capacity so quickly.
Ben Everett.
Thank you, Mr. Speaker. I think something that will unite us across this House is our utter admiration for the great British public and how all parts of our society have responded to this crisis. Our public health officials, of course, families, communities, and today businesses that have heeded the call for ventilator production. Can the Secretary of State confirm that as well as the hotline to call, there is now also an email address to send your response to if you are a business that wants to contribute to the national ventilator effort?
Yes, there is. We've been absolutely overwhelmed with the positive response to the national effort for building ventilators. And that email address is up and running, and we're trying to engage with everybody who contacts us.
Mick Whitley.
Thank you, Mr. Speaker. Can the Secretary of State assure this House that if schools are closed because of the coronavirus, money be made available so that lunches and hot food will be provided to those children in most need? Also, the fact that you did say you took advice from other countries, Ireland closed their schools.
We, of course, are looking at the impact of all the decisions that different countries have taken, and there'll be lots of consequences should we take the decision to close schools, but we have not taken that decision today.
Andrew Bowie.
Speaker, can I first pay tribute to my right honourable friend and indeed all of the staff and officials at the Department for Health who are working round the clock in an incredible situation to deal with this, and indeed his counterpart in the Scottish Government and all of her staff. Working, doing exactly the same north of the border. I know my constituents in West Aberdeenshire and Cardigan appreciate it. Can I ask if he knows if his right honourable friend, the Secretary of State for Transport, will be coming to the House anytime soon to update us on any discussions he's having with the airlines industry? The maintenance of routes is very, very important to the economy of the north east of Scotland, and the survival of these airlines is vital.
Well, it is, of course, something I discussed with my right honourable friend, the Transport Secretary, who I'm sure will be coming to the House sooner rather than later.
Tim Furham.
I encourage people across the country to have complete confidence in the government's medical and scientific advice. That is essential for the safety of this country. But I could also encourage the Secretary of State to ensure that the population as a whole have confidence in their own economic futures. We spent £500 billion in this country bailing out the banks in 2008. We need to be prepared to go even further than that to make sure that people, for example, the 60,000 people in Cumbria working in tourism and hospitality, know their economic future is not about to be burnt.
I do understand the concerns that the honourable gentleman raises, right honourable gentleman, and I think it is important that these concerns are addressed. You know, coming from a small business background myself, I understand the impact that a change like this can make, especially in the tourism industry, which is so important to his constituency. We regret having to take the measures that we do today. And as I said earlier to the right honourable gentleman, the former leader of the Labour Party, this is something on which we're working at pace.
Thank you, Mr. Speaker. The Secretary of State should be congratulated for the calm and responsible leadership he's shown during this crisis. But can I draw his attention to the subject of a hugely vulnerable group, and that is children with immunosuppression, with underlying health concerns. The advice to them is still to go to school, but he will know that any virus can be devastating to them with the low immune system. Will he issue specific guidance to parents who have the concerns with children like these?
Johnson.
Thank you, Mr. Speaker. In talking to my local trust this afternoon, they're doing everything they can to prepare for the potential surge in Covid-19. But what they did say to me, the big problem they've got is knowing what to do if the schools close and what that then means in terms of the workforce and their ability to turn up to work. So can we please have an assurance that there will be a national childcare policy, particularly for key workers in the NHS?
Well, this, allied with the fact that children are safe at school because they do not have significant symptoms from COVID-19, is the reason that we are keeping schools open for now.
Sarah Brittley.
Charities and third sector organisations are also going to be deeply affected by this. Can the Secretary of State inform the House what support will be available to them, especially when they're trying so hard to help in our communities?
Well, my honourable friend is absolutely right to raise what is such an important point, because we need communities to come together, and we need people to come together to help out those who are badly affected by this. And of course that means supporting our charities to make sure that they can keep providing the sort of support which we're going to need in the weeks and months to come.
Kate Green.
Schools are closed, and I appreciate
appreciate that's not the government's position currently. Head teachers in my constituency have asked me to convey to the government that a particular priority must be given to child safeguarding and that this should also become the priority for Ofsted. Will he discuss that with the Schools Minister?
I will. She makes a very good point.
Andrew Griffith.
Mr Speaker, British businesses, large and small, including those in West Sussex, stand shoulder to shoulder with the Secretary of State on the excellent work that he's doing. Can I commend the Advanced Manufacturing Initiative for ventilators, but encourage him to go much, much further into other hard-pressed categories across our health system and our social care system?
Yes, it's been extraordinary, the response to this crisis. Things are happening in this country that nobody would have wished, and things are happening faster than so many people anticipated. But people's ability to respond, even to changes that nobody would have wanted to see, has so far been in many cases remarkable. And we talk about, of course, the NHS and social care, but so many businesses also under intense pressure and under intense stress, looking to see what they can do to help.
Ian Paisley.
Thank you very much, Mr Speaker. The Secretary of State has made it very clear that it is no longer business as usual. However, for families and businesses up and down this kingdom, it is bills as usual. What measures specifically can the government take to introduce rates relief for families and for businesses, a VAT delay for the coming year, and importantly, by HMRC making sure that they give time to pay to people for the most critical bills for their businesses?
The honourable gentleman is right to raise all of those issues, and we will address them all.
Jason McCarthy.
Mr Speaker, we're all looking for clarity in these uncertain times, and I've just been contacted by the owner of a cafe and a hairdressing business in my constituency. I've heard the strong advice for people to not frequent their businesses, putting them under a great chance of not being viable moving forward. Mr Speaker, a lot has happened since the budget last Wednesday. Does the Health Secretary not agree with me? It would now be useful for the Chancellor to return to the House this week and clearly lay out the latest raft of measures available to support businesses, large and small, employees, the self-employed and freelancers.
I will absolutely take that concern directly back to my right honourable friend, the Chancellor of the Exchequer.
Afsana Begum.
Thank you, Mr Speaker. The government has talked of drafting in volunteers to provide care, but people with disabilities and complex needs often have some of the most complex of needs. It's highly unlikely that volunteers would be able to provide the care that is needed. How will the government ensure that people with disabilities will continue to receive the support to stay in their own homes?
Well, of course, volunteers have got a huge role to play in doing jobs that work for their skill set. But for many people, an incredibly high set of skills are needed to support people, for instance, those with disabilities that she raises, and supporting them to get the social care that they need is a critical part of our response to this virus.
Brian.
Thank you, Mr Speaker. What steps is the government taking to increase the availability of high-quality masks and other protective equipment for NHS workers?
We're both distributing personal protective equipment across the NHS from the stockpiles and the supplies that we have, that we've got in place for this purpose, but we're also seeking to enhance the production of these because it's clear that we're going to need a lot.
Thank you, Mr Speaker. Many pharmacies across the country refuse to take prescription requests over the phone. So can the Health Secretary explain what he's doing with the other health ministers across the UK to ensure that people can access prescriptions over the phone or electronically, that they're transmitted directly to pharmacies, and relax restrictions on the supply of medicines, for example, so people get a 3-month prescription rather than a month?
Yes, he's quite right to raise this. In England, where I'm responsible for it, we are addressing all of these points, and I'm sure that the devolved nations are looking at them too.
Claire. Thank you, Mr Speaker. Given that the new advice today is that people should remain at home for up to 14 days if they have a high temperature or a continuous cough, I wonder if my right honourable friend can clarify for constituents what actually constitutes a continuous cough. Is it half an hour? Is it half a day?
It's a cough that doesn't go away. It's not an irregular cough. I can't give any more detail on the specific advice than that. It is a continuous cough. That is the best way to describe it.
Kyle.
Thank you, Mr Speaker. If pubs are unsafe, why is it being left to customers to decide whether they should go there or not?
Because our advice to everybody is to reduce unnecessary social contact in order to protect themselves.
Philippa.
And the personal resilience of the Health Secretary during this crisis, and also all the staff at Kettering General Hospital. Do we have any lessons to learn from the German experience, where they've had 5 times as many confirmed cases, but only a quarter of the deaths?
I've discussed this point with my German counterpart, and I'm afraid I wish that there was something that we could learn from that particular point, because it's important. We think that the reason for that difference in ratio is because the early cases in Germany were largely from people who'd been skiing in northern Italy and therefore were more healthy, whereas this disease, the mortality of this disease is very strongly correlated with age.
Mohammed Jassim.
Thank you, Mr. Speaker. I live with my 80-year-old mother, my wife who has a heart condition, my daughter and sons who attend educational settings, and my 3-year-old grandson. What advice can the Secretary of State give to multi-generational households like mine, where self-isolation is not a viable option and alternatives are far from obvious?
This point is an incredibly important one and directly addressed in the advice that will be on the gov.uk website.
Leslie Buchan.
I have been approached by many 70-year-old plus people who are still in full-time employment. They want to know that if they are still healthy and they are still willing to go to work, that the government is supportive of them doing so.
Yes, the shielding measures where we insist on the lowest possible social contact, they are for people who have existing conditions and will be contacted by the NHS. For those over 70 who are healthy and, for instance, as she says, are in work, we strongly advise them to minimise their social contact.
Alison Thewlis.
Mr. Speaker, to prevent people from stockpiling and panic buying infant formula, will he speak to supermarkets and perhaps insist that they will limit sales to perhaps 2 per family to prevent that? And in the event that breastfeeding support groups are not able to meet, will he direct people to the National Breastfeeding Helpline, which runs from 9:30 to 9:30 every day?
I'll look into the second point. On the first point, that is happening. Those conversations are happening.
Robin Miller.
Thank you, Mr. Speaker. I congratulate the Right Honourable Member for his openness and the quality of the information he's giving us. Could he offer some guidance, please, to the large number of religious communities, churches, mosques, gurdwaras, on what actually constitutes a large gathering of people?
Well, we do address this in the advice, and this is a very important point. We've taken advice on how to respond to this crisis, including from our ethics committee, which includes representatives of the major religious faiths. And it is true that in our advice to avoid unavoidable social contact, we do include religious groups in that. We've seen from elsewhere in the world how sometimes it is through religious gatherings that this virus can spread. So with the deepest regret and with the heaviest of heart, we do include faith groups and gatherings of faith within the advice.
Susan Ball-Potter.
Can I ask that the Secretary of State and the Chancellor, at the very least, write to all members of this House this week with what they understand to be the measures that will be taken to support the self-employed and small businesses in our constituency, because that information is absolutely vital. Could I also just ask him about local authorities, because they are going to be at the front line of supporting family hardship as well as ensuring services reach those in need. That's a mammoth effort at the same time as employees having to be encouraged to work at home. So what financial support, including hardship funds, is the government providing to cash-strapped local authorities, and how, alongside the great and enormous effort being provided by community organisations, is he also going to ensure safeguarding of older people?
Yes, these are all important considerations, and on the financial ones, it is, of course, a question for the Treasury, who are looking at how to address all of these things.
Jerome Mayhew.
Thank you, Mr. Speaker. Hundreds of thousands of students are currently revising for their public examinations. Does the Secretary of State have a contingency plan for GCSEs and A-levels to be sat on time?
That's a matter that the Education Secretary is considering.
Lillian Greenwood.
Mr. Speaker, 70% of people over the age of 70 are living with hearing loss, so it's welcome that most public health messaging on TV is subtitled. However, for those whose first language is British Sign Language, reading written English can be really difficult, and much of the public health messaging is inaccessible. Given the seriousness of the situation, the fast-moving situation, will he ensure that all press conferences featuring a minister, the chief medical officer or the chief scientific advisor have a BSL interpreter present? And how is he ensuring that the communication needs of those with hearing problems are being met when they require health treatment?
It's an incredibly important point. Many of the statements on coronavirus from this dispatch box have been signed, and I understand that the press conference that the Prime Minister gave today with the chief scientist and the Chief Medical Officer was also signed on the BBC.
Jim Whitford.
Thank you, Mr. Speaker. Can I go on record too for thanking the fantastic work of our NHS and care workers and pay tribute to the immense public support out there by community organisations. Whilst we are no longer performing community testing, with consideration being given to testing of NHS staff as a priority, will my right honourable friend advise if this will be extended to social care staff, the police and teachers to ensure that our frontline services continue to operate?
Yes, of course, this is an incredibly important point, and Public Health England are addressing the order of prioritisation, and we're also trying to drive up, as we discussed many times earlier, the number of tests available.
Dishwater.
Schools are closing. London Oratory School in Fulham, which had 1,300 pupils, closed today. And one effect of that is that other schools in the vicinity then come under pressure to do likewise from the school community. There's no criticism of anyone, but can the Secretary of State review and clarify the policy on schools and what happens if they have to downsize and what happens if the policy changes?
Yes. We are, of course, reviewing all of those points, and there are some measures in the bill tomorrow directly to be able to address this.
Smith.
Thank you, Mr. Speaker. The week before last it was shortly, last week it was imminently. Does the Secretary of State know when the public health budgets will be announced? And if he does, could he shed some light on it?
It's as soon as possible. There are so many things that we need to get on with, and this is one of them.
Stephen Kinnett.
Thank you, Mr. Speaker. My honourable friend, the member for Leicester East, referred earlier to reports that the private health industry is planning to charge the NHS £2.4 million a day for the rental of 8,000 beds. Does he really feel that that's the right way to go, given that this is a national effort, that we are all in this together? And what steps will he be taking to ensure that the private health providers are doing their bit?
I do think it's the right way to go, to make sure that private sector capacity available to address this crisis, yes, and it's a matter of all working together to deliver.
Emma Hardy.
Thank you, Mr. Speaker. My constituent can't get mortgage payment support because she hasn't got a sick note to go with being self-isolated. Yes. When will electronic online sick notes be available through the NHS 111 service?
Yes, we are fixing that, but we are also changing the law to ensure that that people who are self-isolating are clearly deemed to be sick for these sorts of purposes.
Dr. Rupert.
Mr. Speaker, among those who can't work from home, who feel vulnerable, are GPs. So can he heed the advice of the locum who came to see me and sort out the inconsistencies of 111 that had been diverting people to surgeries? And also, can he do away with the box-ticking target culture that makes them terrified to perform a number of consultations in a set amount of time? And also get rid of the quaff appraisals, which are just unnecessary, and let doctors be doctors.
Well, my message to everybody in the NHS is that they should do what they need to do to keep people safe in front of them, and we are reducing a whole load of the bureaucracy that gets in the way, for instance, with measures from the CQC as one example, to make sure that people can just do what's right in front of them. She says GPs can't work from home. Of course, sometimes some GP appointments do need to be face-to-face, but increasingly they can be over the phone or over Skype, and so they should be.
Vendra Mishra.
Thank you, Mr. Speaker. Several members have raised the concerns about care staff, and as we all know, many of them are on zero-hour contracts and work for multiple providers. This means that they struggle to prove that they're eligible for statutory sick pay, forcing them to choosing between protecting their clients and paying for their bills. What action will the Secretary of State take to help care staff who are not eligible for statutory sick pay and who cannot prove their eligibility?
Yes, this is an issue that I discussed with the Honourable Gentleman, the Shadow Health Secretary, earlier today, and the package of measures in the budget addresses this as much as is possible, and we're prepared to go further if that's what's needed.
Deputy Peacock.
Speaker, I've been contacted by constituents concerned by the lack of health and safety and testing at our borders. Does the government have plans to implement stricter measures at our airports, ports and rail terminals?
Well, now that there is onward transmission in the UK, those sorts of measures are less efficacious. At the start of this, of course, we have been doing that all along and strengthening it. But there are also those who said go further and stop all of the flights. Of course, the Italians were the ones who stopped the initial flights from China and ended up as the European epicentre of this anyway.
Alex Norris.
Thank you, Mr. Speaker. The Secretary of State has indicated a willingness to revisit the statutory sick pay issue if, as many of us think, the current arrangements do not go far enough. When will he make that assessment?
We're making it constantly.
Russian O'Reilly.
Thank you, Mr. Speaker. Coronavirus has already claimed the life of one of my constituents, and my thoughts are with him, with his family. What action will the Secretary of State take to prevent the closure of the Mildmay Hospital in my constituency, which can relieve some of the much-needed pressure from the Royal London Hospital? And can the Secretary of State explain what action the government will take to put restrictions on the rising price hikes of the supply side of goods, and also restrictions on panic buying, which is understandable given the guidance is changing, but we need to get a grip on it to protect vulnerable and poor people in our constituencies.
We are looking at all of these points, and with respect to the last one, this is a matter that the Environment Secretary, responsible for the food supply, is looking at very closely. We are confident in the food supply of this country, even in the grip of this crisis, but we've got to make sure that people behave responsibly in buying only that which they need.
Lesterson.
If the advice to customers is that it's safer not to go to bars, restaurants and theatres, presumably the same advice applies to members of staff in the hospitality sector. So why isn't the government saying to all businesses in those sectors that they must close, which then puts them in a much better position to claim on their insurance?
We've taken a decision on health grounds to make the changes to the advice that are deemed necessary according to the scientific advice and the medical advice to keep people safe. I understand that there are consequences, huge consequences of that for businesses right across the country, and my right honourable friend, the Chancellor, is leading the work to support these businesses.
Mr. Speaker, in Shetland we have 15 of the 171 confirmed cases in Scotland. That's almost 9% from an island community of 22,000. In normal circumstances, anyone requiring intensive care in Shetland is taken by air ambulance to mainland Scotland. Because of the nature of coronavirus, we can't do that. I understand that the military assets will be engaged for that transportation, but clinicians tell me that there's no understanding of the protocols and there's not even yet been a dress rehearsal. Will the Secretary of State speak to his right honourable friend, the Secretary of State for Defence, to ensure that all necessary communication happens, to ensure that when this service is needed, it will work?
Yes, I will, and we'll make sure that we support people on all parts of these islands and all islands that are part of these islands.
Pongasari.
Mr. Speaker, I've been contacted by a constituent of mine in Erith and Thamesmead. His elderly grandparents are stranded on the Fred Olsen liner. Can the Secretary of State please tell me what action he will be taking to provide support to those stranded with coronavirus?
Point. My right honourable friend, the Foreign Secretary, is leading on this response. We've already provided medical capability to try to support people who are on board. It's a difficult situation, as I'm sure that she will understand, and we're doing the very best that we can.
Speaker. In recent days, I've been speaking to health workers across the sector and also to our local council about our schools. I understand there's a strong undersupply of hand sanitizer, and Warwickshire County Council tried to order £19,000 worth and could only get half that for its schools. Can the Secretary of State update us on what he's doing in terms of generating production for that?
Yes. We are keen to see further production of hand sanitizer. There are not many hand sanitizer production plants in the UK. And I would add that soap is better than hand sanitizer, but nevertheless it's something that we're working on.
Matthew Pennington.
Thank you, Mr. Speaker. Could the Secretary of State for Health please speak to his right honourable friend, the Environment Secretary, about what more can be done to guarantee essential food supplies to those who are symptomatic and self-isolated? Right. In the absence of his national volunteering scheme, which is not yet in operation, at least in my part of South East London, people are phoning me over the weekend to say they can't get essential home deliveries, they've been cancelled, they can't get them for 3 weeks, they've got no friends or family around, and they're too sick to go out.
Yeah. Hear.
I talk to the Environment Secretary almost daily about this. It's obviously incredibly important, and it's important that within communities people help each other to be able to get essential supplies.
Thank you, Mr. Speaker. This morning I visited Turney School in my constituency, a special educational needs school with an outstanding track record of the education it provides for its students. As well as education, the school also provides vital emotional and social support and respite for families. And the staff there are very worried about what will happen in the event that the school has to close, about the provision of social care for families who often live in overcrowded accommodation, and 90% of whom are eligible for free school meals. Can the Secretary of State say what measures he is taking to ensure that social care capacity for such families will be expanded in the extent that schools are forced to close?
The Honourable Lady, Mr. Speaker, makes an important point, which is that the consequences of closing schools is very, very complicated, and is something my honourable friend, the Education Secretary, is addressing directly.
Lots of my constituents in Bradford West, for the Muslim and Jewish community faiths, have concerns about burials because they want to bury as soon as somebody dies. Now, given that we might sadly lose people to this virus, what conversations has the Minister had with religious institutions across the country with regards to this?
The Community Secretary leads on this question because ultimately local authorities have got an incredibly important role to play in making sure that this happens smoothly. There are further powers in the bill that will be published, the details of those will be published tomorrow, to try to make sure that we have what we need to address the difficult situation.
Thank you, Mr. Speaker. Over the past month, we've heard an awful lot about the government's science-based strategy to dealing with this crisis. I'd like the Secretary of State to provide with me and my constituents an idea in terms of the modelling that you are using so that we can understand, given the herd immunity strategy you seem to have been pursuing, just how many fatalities we could be seeing in this country, and if you are still pursuing that strategy, or if you have changed strategy instead to go in the direction of actually saving lives.
No, we're very clear that herd immunity is not part of our plan, and it's a scientific concept. It is not a goal or a strategy. And on the first part of this question, yes, we will be publishing that modelling.
Thank you, Mr. Speaker. In the interest of transparency and public confidence, can the Secretary of State just clarify whether he will be publishing the advice that explains the rationale for how testing will be expanded, so that people understand what groups are going to be tested next and how those cohorts are going to be prioritised?
I'll look into that question and get back to him, yes.
Karen Buck. People without a home of their own have particular challenges when seeking to self-isolate, which puts both their own health at risk and that of the wider public. Can the Minister assure me of two things? Firstly, will everybody who is street homeless be guaranteed the opportunity to self-isolate if they start showing symptoms, because people are being turned away from shelters at the moment? And given that tens of thousands of people are evicted every year, will he take action now to ensure that more people are not added to the homelessness total? This
is a very important point that's being addressed by my right honourable friend, the Community Secretary, along with the mayors and the local authorities who lead, in many cases, in the provision of these sorts of services.
Hopkins.
Speaker. Many local services in my constituency are supported by the third sector, such as charities like Luton Food Bank. They're going to be hit by a double whammy of many of the volunteers being 70 or over or living with people who may have long-term conditions, and equally having to cancel large fundraising events because they're large gatherings. What support can be provided for those organisations?
Well, in answer to a previous question about charities, I made the point that we have a charitable sector who have a huge role to play, including with the increase in volunteering, in the response to this unprecedented crisis, and we'll support them in whatever way we can.
Robinson. Speaker, and thank you for your generosity in letting this statement run into the Health Secretary for dealing with all the questions. What advice does he have for my constituent, Mr Emerson, who is in London today to collect a private script for medicinal cannabis for his daughter, who at 3 years old relies upon it? He can only cash the private script in London, and he has to travel to London every month. He has asked for 3 months' supply in case he can't travel from Belfast to London in the months to come. Could the Health Secretary give any advice or guidance for him or for the Chief Pharmaceutical Officer?
We're trying to address the precise point about the supply of medicinal cannabis products through a change to the Home Office regulations anyway, but also the advice is against unnecessary travel, and that sort of travel that the Honourable Gentleman describes sounds very necessary to me.
Alex Sobel.
Thank you, Mr Speaker. Later, at the height of the crisis, the Secretary of State will be judged on the answers he gives today. At the beginning of the crisis, there were only estimated 5,000 ventilators in the NHS. Can he tell us exactly how many ventilators he has purchased, and what the modelling says about how many ventilators we'll need at the height of the crisis, and whether we will be able to get everybody on a ventilator at that point?
As the Honourable Gentleman knows from my previous answers, this is not the way that we're addressing this question. The way we're addressing this question is that we will buy as many ventilators as are made. It's not a question of putting a target on it. We are just going after as many as we possibly can.
Rosie Duffield.
Thank you, Mr Speaker. Gaps in NHS capacity, particularly in mental health services, have been filled in recent years by excellent local charities in my constituency, such as the Home Start service in Canterbury, which supports isolated, disabled and terminally ill parents in their own home. However, they have now almost completely run out of money, and I'm going to ask the Secretary of State how he suggests that I support them to continue now that we need their services, as he alluded to, more than ever.
Well, I think that if the Honourable Lady speaks to her local CCG, to the extent that the charity, who I pay tribute to, can support the local effort, then the CCG will be best placed to make that judgment.
Durham.
Thank you, Mr Speaker. Following the Secretary of State's statement this afternoon, IPSA have announced that their office will be closed, with staff who are able working from home, and their phone lines will be closed, and all inquiries will be answered by email. Will this be the approach of the other government departments in response to this crisis?
Mr Speaker, I'm responsible for many heavy responsibilities. I hope I've answered questions about activities of almost every department of government, but I am not responsible for IPSA. It is not a department of government. It is independent, as we well know, and I'm sure that Mr Speaker will have heard that the concern raised, and I'm passing this one to you, sir.
Thank you. Chris Elmore.
Speaker, could the Secretary of State set out in more detail in terms of 4 medical staff who are brought back in to deal with the virus are put onto the correct registers and also have the most up-to-date qualifications and training that they need to deal with it?
Yes.
The last, but certainly not the least, Jim Shannon.
Mr Speaker, I have the strongest legs in this chamber. Thank you very much. Minister, could I ask what advice the Minister has given in relation to discussions that have been had with banks and lenders regarding mortgage payments? And would the Minister, in his capacity of answering for every department, be able to tell us if there would be specifically a 3-month freeze on mortgage payments, which would be extremely helpful? After all, banks and building societies have a role to play as well.
My right honourable friend, the Chancellor of the Exchequer, is in a constant dialogue with the Governor of the Bank of England and with the banks themselves. There were active discussions over the weekend about what further measures can be brought forward. He's right to ask this question of a different government department of me, and we are working incredibly hard right across government to address this concern and indeed every concern that honourable members from all across the House have rightly raised this afternoon. And may I say, Mr. Speaker, I'm very grateful for you allowing me to make this statement at an unusual time, and I will commit to coming before the House whenever necessary to answer each and every concern.
Point of order, Clive Whitford.
Mr. Speaker, we all appreciate